and welcome to We Women Want. This is a special show for women, by women, where we talk about women issues. We discuss, anything from legal rights to today the topic is we're going to be talking about IVF, assisted reproduction. We even discuss simple things like, what it takes to juggle life between working and the home life, all kinds of things. So really, this is not just a show, this is a support group for women all over. So welcome to this conversation. I have joining me, as I said, today we're going to be discussing IVF. We have people who've gone through it. We have a panel of doctors who are going to help you understand the process from the very beginning, the pros, cons, what it entails. So let's quickly begin this conversation. Joining me on the panel is Dr. Gauri Agarwal. She is a founder at the Seeds of Innocence chain of IVF and gene string diagnostic centers. In fact, she single-handedly has began this project and has expanded it to about 15 units all over. There is Dr. Suveen Ghuman. She is the senior director and the HOD of infertility and IVF at Max Hospital. She's also the general secretary of the Indian Fertility Society. And also is Dr. Tanya Bakshi Rotagi. She is also with Max. In fact, Dr. Tanya specializes in cancer patients and genetic tests. And she's also doing rejuvenation of the uterus with plasma therapy. In fact, she introduced plasma therapy at Max. So I think without any further I would ask you, in fact, Dr. Suveen, if you can help us introduce, for the layman, how would you explain what is IVF?
So basically, IVF means in vitro fertilization. That means fertilization outside the body.
All right.
So basically, it means stimulation of the woman's ovary to give enough eggs with injections. When they are mature, we take out those eggs, we fertilize with the sperm, we make an embryo, which is either 3 days or 5 days, and we put it back into the uterus. So what is not happening in the body, we are doing outside. And subsequent to that, it actually depends upon nature whether the pregnancy will hold or not. So IVF is not a short pregnancy, but definitely increases the chances because we are doing things outside, seeing them under our eyes and making sure that the embryos reach
So Dr. Gauri, if you can just help us understand the kind of profile of people who you think are eligible for it. Is there some criteria that you look at, whether it is age, whether, I think you do some testing also to figure out who's good, who fits the bill?
So I think the most important thing is that when a couple comes to you that कि शादी के बाद 1 साल हो गया है और अब हमें बेबीज नहीं हो रहे हैं.
Right.
So important is कि we have to screen the couple. And I think 3 basic tests जो बहुत ज़रूरी हैं on screening is कि एक तो फीमेल की ट्यूब टेस्ट करना कि फीमेल की ट्यूब्स खुली हैं, sperm count is okay, and eggs are forming good, and on ultrasound the uterus is happy and good looking. So if everything is good looking, then
like the happy uterus.
Yeah, happy uterus. So I mean, you can just try with medicines.
Okay.
But if you realize that the tubes are blocked, the sperm count is very low, the eggs are not forming well, or she has some problem in the uterus, so first you treat the problem.
All right.
And once we know that, the tubes are actually blocked, बिल्कुल भी AMH down है, ovaries respond ही नहीं कर रही हैं, and I mean the sperm count is very, very low, then we recommend them that you need an IVF. So before suggesting an IVF, बहुत ज़रूरी है कि हम एक couple की proper screening करें कि whether this couple needs medical treatment की दवाई से ही, and counseling works at times. Either एक IUI की ज़रूरत है that everything is normal and not able to conceive, or she needs an IVF.
Okay, she needs an IVF. फिर क्या करेंगे आप?
So if she needs an IVF, the most important thing is that you first need to counsel everything about IVF. What is IVF? How is it done? What is the time frame it requires? What is the success rate in your case? What all procedures will happen? What are the side effects? And what will actually ultimately, they have a lot of myths about IVF, whether it's going to be a natural pregnancy, it's going to be a cesarean, and can I show to doctor outside, who's near to my hometown, if couples are coming from long,
Yeah.
I mean, I do have to come to you for pregnancy.
You need them to come frequent visits.
Yeah, absolutely, because we give them injections for 10 days and we need to monitor them in between कि वो eggs कैसे बन रहे हैं.
ठीक है.
So they have to come at least 4 to 5 times for the procedure. So there's so many things. We first need to counsel them before we start the procedure.
You're also dealing with a lot of cancer patients, and what is this plasma therapy that you do?
So they're two separate things.
Okay.
And the first thing we'll talk about is cancer survivors and also people who've just been diagnosed with cancer. It could be men, it could be women. And I think we're out here not only bust myths, but also give hope. So we want to tell people that there is no couple who cannot conceive and procreate. So really, it's a very individual therapy. So now we know with treatment, there is a longevity to cancer patients. The survivor is much better. We're testing, so we're diagnosing it early. Early stage में हम diagnose करते हैं. So there is a chance that with their own gametes, हर औरत चाहती है उसी का बच्चा हो. Every man wants कि
Right.
मेरा ही sperm हो. So for them, there is a window, and that window is very critical. So if we use of the techniques that we have, so be it a man who is a cancer survivor or be it a woman who's a cancer survivor, we have treatments and therapies to freeze and store their either the sperm, their egg, or make an embryo and freeze it so that they're able to use it in the future and they become parents.
All right.
So I think it's very important to know that there was a time where it was like a death sentence. It's not. So there is hope, and there's hope for every couple. Now going on to plasma therapy. So there are a group of people, as she said, happy uteruses. There are some whose uteruses are not so happy.
Okay.
And there is treatment. So for example, for whatever reason, in our country, tuberculosis is very common. Or for whatever reason, if she's had repeated miscarriages and surgeries because of that, that the lining of the uterus gets, it's not optimum and is on the weaker side. So what we do is we take the blood from the patients, clear it, get the growth factors, prepare it, and that is the platelet-rich plasma. And then we put it inside the womb and kind of do a rejuvenation therapy. Although it's experimental, but that's a treatment, again, which is being added on. So as we know, science is this huge armamentarium which we start and we keep adding on things. So just like we've got genetic tests to find out, is the embryo okay? Same way, if the uterus is not optimal, what can we do? So this is just like there's stem cells, which is slightly different. Platelet is slightly easier because they're taking your blood. We take about 20 to 25 ml of blood, then we prepare it, and then really highly concentrated growth factors are used to rejuvenate. It can be used for the lining, so for the uterus. It can even be used to rejuvenate the ovaries. So again, both are experimental and they have to really carefully be selected. So it's not that a therapy is out there, everybody should use it. So there are selected candidates and we
qualify.
must have the right therapy for the right patient.
But plasma therapy is something that came up, I think, during COVID times. Everybody was expert on
So
plasma.
I had this very beautiful case. So this patient comes to me and she says, मुझे donor eggs नहीं चाहिए. And her ovaries में AMH, like anti-Mullerian hormone, was very down. So I started stimulating her, but she could not form eggs. So I said, okay, let me try ovarian PRP in this case. And I did a cycle of ovarian PRP. In one cycle,
PRP.
So the platelet
platelet-rich
plasma therapy.
she was talking about the uterus.
Okay.
So we prepared that plasma and we injected in the ovaries with the needle. And then one cycle I waited.
Sounds painful.
Absolutely not. It's done under anesthesia.
Okay.
So it's very, very simple. Under anesthesia with an ultrasound, you just inject that plasma into the ovaries. It's a 5 minutes procedure. You do it twice in a cycle. You wait for one cycle. और उसकी अगली cycle में आप injections लगाओ. I got 3 eggs. She got 1 embryo of her own and she conceived.
Wow.
So that's a beautiful case study we have. And now तो हम तो बहुत ovarian PRP कर रहे हैं, like ovarian plasma, where अपने eggs नहीं बन रहे हैं, but they are not willing to go for donor eggs.
Well done. One quick question: ovarian stimulation. What, Dr. Gauri, how is that done? That's done by hormones, injections.
Injections.
Okay. Sumeen, sorry.
Yeah, so no, I was saying PRP, like Tanya said, it is giving hope to a lot of people. And I think we've had good success
We've had
rates.
very good
at
success
Max.
rates. So,
very good.
There are people who have been told, like she said, some who can't have and hold their own pregnancies. So for a woman, surrogacy is there to help a lot of women, but still in our country, everyone wants to feel that pregnancy. So again, it is a technique which is giving hope. But I'd like to reiterate again, it's not for everybody. Sometimes it's also being used for various indications where it may not give us fantastic results. So carefully go to the right center, make sure you're the right candidate, be it for the uterus, be it for the ovaries. These are all experimental therapies, so we have to use it very judiciously.
Okay.
And I think that one thing is also very important is जो हम PRP ready करते हैं ना वो भी बहुत जरूरी है.
मतलब?
Because there are a lot of companies coming up, ये kit खरीद लो, वो kit खरीद लो, हम PRP ready कर रहे हैं. So like at Seeds, we have a genetic center. So we have a proper machine where we prepare the proper PRP. Obviously, आपके पास भी है.
Absolutely.
So
We are preparing our own PRP.
PRP.
So it's the technique
very
of how you
important
prepare the
that
blood.
you
Again,
get
you
that.
need
Very, very
specialists to
important.
prepare
Yeah.
it in the right center, in the right place to give the optimal results.
Okay.
So I think that's
Yeah,
also
that's
important.
very, very important.
Dr. Suveen, also, you also, with the Indian Fertility Society, you're a general secretary there. Do you look at legislation? What does the society do? And
Yeah, so
tell
we
us
are
a
very
bit
much
about-
into legislation, and recently the ART bill has come out.
Can you
This
explain
was in
thoda?
December 21. So prior to that, there was actually no law for IVF. There were regulations which were not necessarily being followed because there were no punishments. But now there is a law like a transplant law. There's a law for ART.
Okay.
And I think it was much needed because there were smaller IVF centers cropping up. Nobody knew what was happening. And maybe a lot of work which should not be have been done was being done. So with the bill coming up, there is a regular legislation in place for people who are doing IVF. There is a minimum standard of space, of who will do it, of who the embryologist should be, what are the qualifications, what is the equipment to be put in, which was not there earlier. And even, smaller units like just one room, they would open an IVF center with no qualified person being there.
Acha.
So this was really much needed, and IVF is such a branch that really the patient can't check what is happening because what is happening in the lab, nobody knows. So ethics is really important and legislation is really important. So they brought up legislation like minimum age for a person or a maximum age for a person to, avail IVF.
What is the age?
So the age for a woman is not more than 50 years and for a man is not more than 55 years. So in that process, we have stopped, you will no longer see news items of a 60-year-old grandmother trying to produce for her grandchild.
Right.
Okay, that will finish off.
Okay.
And it was really sad that women of 60 were, getting
Used
pregnant
as,
and yes, it was
carriers.
really sad. And then there's so many other things like third-party reproduction, the donor cycles. So there is a regular insurance in place for the donor in case something happens to her, which was not there earlier. So any donor complication, good centers would look after their donors. Like we were very careful about looking after our donors. But smaller centers would do nothing for the donor and the woman could go nowhere. So similarly for surrogacy, they have everything set and there can be no unethical practice. That much needed for India.
Well, Gauri, what is the profile of people जो आते हैं आपके पास? Obviously, the young first-time parents, young parents, as you said, but people wanting to become. The background, are they professionals? Are they, people जिनको family pressure है? What are the?
बच्चा तो सबको ही चाहिए. So I mean, there is no profiling in IVF.
Right.
I get all kinds of patients. So I have centers in Patna, like they come across from everywhere. Ghaziabad, I said, I get patients from all over, UP West coming over, and they are like farmers. They are like all profile. So I feel everybody needs a child. So if you sit in Delhi, you have professionals coming from everywhere. So this year, I think I had a lot of people coming up, जिनको COVID में they had second wave में their kids expired. So I had like 5-6 couples right now coming at 46, 47, 48 that my child expired in COVID. I need to undergo IVF.
You
So
know
that
how
was
this
really
profile
pathetic.
has changed over the years? In my practice, what I have seen is earlier it was only the metros and A cities. Now we get people even from B and C.
Yeah.
There will be
Everywhere.
somebody in a remote area in Bihar saying, I Googled, I found, and I booked an appointment.
Yeah.
Because it has become accessible to them. And there is a little bit of acceptance creeping in even in these cities. So that way India has done well. We have managed to, reach out.
And again, international market also has changed. I think there was a pre-COVID era and there's a post-COVID era as well. And I think we've become a global world. And I think India has become an epicenter for health. And IVF, we've got such great results and we've got everything that the West has. So I think it just showcases the fact that, we've already got the best of doctors,
So
best
what
of
are the
facilities.
results? Before we take a break, what are the chances, results?
So the
What is-
results, well, in our center, we have them right in front and every month they are displayed on our dashboard.
No, but generally, not
So,
center specific.
Generally, it would be between 40 and 60 depending upon the center and depending whether you're doing a young woman, an older gender woman, whether the male factor is there or not. So your results vary according to the profile of the patient. So you can't give one single result.
I think age of the woman is the most important determinant. But we also have to remember age of the man. And I think it's the couple per se. As we said, so what happens, that's another myth. People come, even maybe someone who's 42 will think, oh, I have a 40% success. And that's not true. So a 30-year-old would have a different, so suppose a 30-year-old, her tubes are blocked. Her success would be very good compared to a 40-year-old whose tubes could be open, but actually the reserve is not that good. So eggs are older. The eggs quality is declining.
So like in a normal pregnancy, the age is important.
Absolutely.
But I had this like very, very nice case. I'll discuss one more case. So मेरे पास एक couple आया गुड़गांव से, well-read, professional. One IVF failed outside, 28 years old. I did a pickup at my center, मतलब eggs निकाले मैंने. I had just 4 eggs. I said कि तुम्हारा एक IVF fail हो चुका है. So she said, ma'am, आप ना मेरा ना genetic testing करो इसमें, because मेरा एक IVF failed है. I want to get my embryos checked कि कोई problem तो नहीं हो रही है. I checked her embryos. Only one embryo was normal, and she had a classical 21 trisomy Downs in one of the embryos, Down syndrome. I transferred the healthy one, and she conceived. So I think. Eggs be important. Everything is important. Age is important. Eggs is important.
But she's made a very important point that with this you can also check if the baby is healthy
or not. That is so important today.
That's where the genetic
testing
and I think in West nobody does an IVF cycle without the genetic testing.
Okay, I'm going to take a break and come back, and we actually have a case study with us. We have parents who've undergone IVF testing who are, willing and happy to come and talk to us, because that's the other thing we've noticed is a lot of people go through it. We've heard the numbers, but most people feel hesitant coming out and talking about it, and that is something that needs to be done, which is why we have shows like this, and I'm really grateful for them for coming and sharing their story, because this is something we really want to encourage. It's a ray of hope for a whole lot of people. So stay with us, don't go away. Hello and welcome back to We Women Want. This week we are discussing in vitro fertilization, that is an assisted reproduction technology way to, if people who cannot conceive and have babies, well, there is a solution for them. And I have a panel of doctors. We've been talking about it. But we also have, I'd like to welcome, we have parents here who've actually undergone this and are happy to come and talk to us. In fact, Dr. Tanya was the doctor that helped them.
Daman and Parminder.
So if you can just share with us why you went in for an IVF, and how did you hear of it? Were there any hesitations? What went through your mind, or you were saying that you already knew about it?
So as Dr. Gauri mentioned, like all parents, we also wanted to be parents, and we'd been trying since the first year of our marriage, and we'd been sort of putting it off that maybe it'll happen. After about a year or so, a lot of our friends, had kids, and we were feeling a little bit anxious, if that's the right word. So one of our very close friends had actually been with Dr. Tanya, and they recommended her highly. We met her, and the first part was that in the first meeting, she made us so comfortable. Like most doctors are completely inaccessible. They'll give you 10 minutes. We had a 1.5 hour first meeting with Dr. Tanya. That was the start. And it was an up and down journey.
How long did it take?
From meeting Dr. Tanya to conceiving was about 6 months. We were off for 3 months because my mother-in-law was again a cancer patient, and in the middle she expired, so we took a little break at that time. But the hand-holding that she did. So I think it's more to do with the counseling that you get from the doctor. That bond that you form with the doctor
Which is what Gauri
is
said,
most
the
important.
first step is the counseling.
So I'm the only Y chromosome here, right?
I can see you're well versed in
Yes. So she made me feel so comfortable. So like when there's a taboo, so let's say when I first met her, when we did the first test sperm count, my sperm count was fine. 3 months down the line, we did the test, and it was suboptimal. But that's okay. So she told me that that's okay. That's not a reflection of anything that has to do with, there are so many factors that could lead to this. We did a cycle. She put me on some medication, some antibiotics, and we were able to achieve what we were able to achieve.
And now you have a 8-year-old daughter.
Yes, and now we have an 8-year-old healthy daughter.
Were you a little apprehensive that, in terms of healthy, because sometimes the child would be premature, or was it like a normal, process? What were your biggest fears?
So our biggest fears to begin with was, will we conceive or not?
Fine.
So once that happened, the best part was that the screening which was done at every stage was extensive. So even the radiologists that were involved, there was a lot of very good hand holding, I must say. So we were comfortable through the entire process. And as far as the taboo is concerned, I think that was the next what we were discussing. So in our country, everything is a taboo. If you're too dark, it's a taboo. If you're too tall, it's a taboo. If you're too short, it's a taboo. 40 years back, if you had TB, it was a taboo. Fortunately, we also have a very short memory in this country. So what happens is, today it's a taboo. Down the line, when you're there, when you've reached, everybody forgets everything. So I don't think taboo is something that should really be concerned with something like this. The joy of being parents, I think it just takes over everything else.
I think you just made your daughter very proud. But thank you for this. Can we ask some questions from the audience, if anyone would like to, ask our doctors anything?
So, ma'am, I have heard that IVF procedure is quite painful. So, is it really painful? The injections, the everything.
As a person who's gone through IVF,
he should only
probably,
tell it.
I think Daman should speak about her experience, and I would like to share as a doctor. I mean, she was also a very strong, motivated, but a person, she's a lawyer. She worked all through, so there were taboos. The day we did the embryo transfer, that's another myth, hum bed rest kar rahe, doctor, hum bed se hi nahi uthenge. So, again, things which are not real and not needed. Right the next day she was working, she worked all the way through, and I think she will answer to tell you, someone who's gone through.
Good point. Daman, if you could help.
Absolutely, absolutely. So yes, it is painful if you want it to be painful. I think it's all in the mind. As any injury, anything that you go through, any illness is painful. So it's all in your mind. There are injections, there are processes, and like Dr. Gauri also mentioned, we go, they take a lot of precautions and put you through the GA and all the steps that you've taken. You don't feel a thing. Even through the medicines that you go through, you take those medicines, the injections that you take. It's just, for me, it didn't really feel like I was taking a special treatment to get pregnant. It seemed like, okay, I was doing my doctor visits as I would go to a normal gynae and have that conversation. It's just some extra vitamins I had to take to be able to do that. Because I did continue my work as well. Literally, when we did the extraction, next day I was at work. So for me, it really was, through the doctor's help, it was a journey where I could feel that it was a normal process as well, and something that was not different didn't make me feel different. Because personally speaking, it was a little scary to begin with when I learned that my tubes were blocked, and that's when we discussed that, is there a way, should we go ahead, should we not go ahead, what's going to happen? The tubes were extracted. But through this process and the counseling that we received from Dr. Tanya, the fears went away. So the pain also goes away when your doctor is with you through and through. And when you share your journey with the doctor, and the doctor is very helpful in explaining to you,
How did you know about IVF? Were you considering other methods?
So like he mentioned, we started as any couple would do when you get married to, normally. But when we weren't, we didn't want to really waste any time because we married pretty late. And our friends started also going through this. So one of our very good friends had already gone through the journey with Dr. Tanya, and they had a fantastic story about it. So it gave us a lot of confidence. So others' experiences, I feel, also help. So if we tell our story, other people will also be encouraged to be able to say that, okay, it is not that bad. So we can also do it. It's not a scary thing.
Did you want to add something to it?
I would just like to say that I think the IVF doctor plays the most important role in relieving this fear that you're undergoing an IVF. And once you counsel them, I think you should involve the family also in it. So for me, I think very important is whenever a woman comes, I always tell the husband, you have to come every time with her for the injection also. Because anyways, India में आज भी है कि woman के साथ जब husband होता है ना तो उसे लगता है नहीं, I am secure, I feel safe, मेरे पास support system है. So that is very, very important. So I feel that counseling and social counseling and family counseling with the woman is very important. देखो इंजेक्शंस ही हैं, कोई पेनफुल प्रोसीजर एब्सोल्युटली नहीं होता. इट्स जस्ट इंजेक्शंस एंड फिर तो हम एनेस्थीसिया देके एग्स निकाल रहे हैं. सो इट इज जस्ट द फियर इज ऑफ आई थिंक कि कोई प्रोसीजर होने वाला है मेरा, एंड आई डोंट थिंक सो इट्स अ पेनफुल प्रोसीजर.
And as Daman told us, it's very normal, and I think that is something that is recommended. I think that is really the biggest takeaway from this show, is that this is something that is normal. This is something you should not hesitate or shy away from. It is there, and why not? Everybody wants to be a parent, as we, this thing. So why not give it a shot? But thank you all for this conversation and for coming and sharing your experience with us. Thank you.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.